Phenelzine is a drug that is used to raise the levels of certain chemicals in the brain to treat the symptoms of depression when other methods have failed. This drug is an MAOI, or a monoamine oxidase inhibitor. These are chemicals which inhibit the activity of monoamine oxidase enzyme families, which means that they stop the enzymes from breaking down norepinephrine and serotonin. These are used for patients who do not respond to other drug types for the treatment of depression. This drug is not a controlled substance. It carries a pregnancy risk level of Category 3. The generic is manufactured by Gavus Pharmaceuticals. The typical dose consists of a 15 milligram tablet taken orally 3 times a day, but doses may range from 60 to 90 milligrams daily. On June 9th of 1961, the FDA approved Nardil. It was manufactured by Parke-Davis, and it was known as Old Nardil. In the fall of 2003, the manufacturing was transferred to Pfizer. They changed the inactive ingredients, and it was now known as New Nardil. Frequent side effects include orthostatic hypotension, restlessness, GI upset, insomnia, dizziness, headache, lethargy, asthenia, dry mouth, and peripheral edema. Occasional side effects include flushing, diaphoresis, rash, urinary frequency, increased appetite, and transient impotence. Rare side effects include visual disturbances. Phenelzine interacts with CNS depressants, amphetamine, ephedrine, caffeine-containing medications, other MAOIs, dopamine, tryptophan, tricyclic antidepressants, insulin and other oral antidiabetics, opioid analgesics, caffeine, chocolate, and tyramine-containing food. That means no stronger aged cheeses, cheeses made from pasteurized milk, cured meats, smoked or processed meats, pickled or fermented fruits, soybeans, snow peas, dried or overripe fruits, meat tenderizers and meat prepared with tenderizers, yeast extracts, and alcoholic beverages, or any combination of the foods. Phenelzine is contraindicated in those with a hypersensitivity to any of its ingredients, those with cardiovascular or cerebrovascular disease, hepatic or renal impairment, or phenochromocystoma. It is also contraindicated with use of any of the previously mentioned drugs. Caution is warranted for those who are pregnant or breastfeeding, have kidney disease, diabetes, epilepsy, or schizophrenia, or have a family history of bipolar disorder or suicide attempts. This medicine may also increase mental or emotional problems leading to thoughts of suicide and violence. It may cause high blood pressure and dizziness or drowsiness. While this drug does have many restrictions with use, it's indicated for use by those who have had no success with other drugs. The benefits may therefore outweigh the cons associated with its use. There are many who claim that this drug is ineffective, especially since the change between Old and New Nardil. But there are also many who claim that this drug has relieved their symptoms, despite the change in the formula. After researching, I have decided that I am neither for nor against the use of this drug. You'll just have to try and see if this drug is effective for you or not. And that's it. Are there any questions?
Created using Powtoon.